The article is a summary but comprehensive overview of cystitis, or bladder inflammation, in cats, covering its symptoms, causes, effects, and treatment options. Symptoms: cats with cystitis may display frequent urination, urinating outside the litter tray, painful urination, blooding urine, over, grooming around the genitals, and in severe cases, urethral obstruction. Causes: cystitis in cats can stem from infections, bladder stones, tumors, stress, or urine crystals. Feline idiopathic cystitis (FIC), where no specific cause is identified, is common in cats under 10 years old. Severe cases may result in urethral obstruction, which can be fatal. Treatment: traditional treatments include increasing water intake and using various medications, though none are curative. Stress reduction through techniques like multimodal environmental modification has shown promise. Supplements or antidepressants like amitriptyline may also be prescribed. Conclusion: cystitis in cats necessitates prompt veterinary attention. With proper treatment, most cats can lead comfortable lives.